The House comes to questions for oral answer. Question number 1 in the name of the Honourable Annette King.
Thank you, Mr Speaker. My questions to the Minister of Health. What responsibility, if any, does he take for a lack of access to health services for New Zealanders?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, the member's question is very broad. When she asks about access to services, is she referring to the increase of 50,000 operations a year, or the increase of 110,000 specialist appointments a year, or maybe the fact that we've improved cancer treatment such that no patients fly to Australia in contrast to her 761? Or maybe it's about the extra 400,000 plus children getting free doctors' visits and prescriptions. What I do know that I'm not responsible for is the cut of 1,000 surgeries at Capital Coast District Health Board between 2000 and 2005 on the member's watch.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
When he takes responsibility for children receiving free doctors' visits, does he also take responsibility for the 93 children who were waiting in Northland at June, up from 48 in January, for surgery for rotting and abscessed teeth?
The Honourable Dr Jonathan Coleman.
Well, as the member knows, that's not my delegation. But what I can say, you do know that it's not my delegation. You've actually addressed that to the wrong minister. What I can say is, in all dimensions across health, we've increased services for New Zealanders. And if you look at the global picture, more New Zealanders are getting more services all the time. A big change from her failed reign as Health Minister.
Supplementary question, Mr Speaker.
Supplementary question, Simon O'Connor.
Oh, they've got to get the cavalry in.
What recent reports has he received in relation to individual cases raised in question time?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, last Thursday in question time, Mrs King raised the case of a woman called Catherine from Whangarei, whom she claimed had had her home support cut. So I went and followed up on that case and asked for a report from the Northland DHB. It turns out actually that the DHB did not cut the support for this person, but in fact the individual had requested the support to stop. The DHB then followed up on this request with the patient, who has since agreed to 5.5 hours of home management and support a fortnight.
Order. The House all settled. I've heard most of the answer till now. I want to hear the balance of the answer.
Yep. This is yet another example of this member getting her facts wrong, just as she did claiming 22 of 26 GP clinics weren't giving free under 13 visits. No wonder I question the cases she brings before the House, because when we check up, they seem to be wrong.
Question.
Supplementary question.
Table a last name.
Order. Point of order has been raised.
Tabling the last name would be an invasion of privacy.
Order.
Mr Speaker.
Can I just advise the Minister, I'm calling for him to present a point of order.
Yes.
No need to have a conversation.
I seek leave to table a report from Northland District Health Board detailing what really happened with Catherine from Whangarei.
Leave us to table that particular report. Is there any objection? There is none. It can be tabled.
Supplementary question,
Supplementary question, the Honourable Annette King.
When he takes... What's that, Jerry?
Order. Right. Only one warning to Mr Brownlee today. So consider that he's had it, and we will now continue with supplementary questions.
Thank you, Mr Speaker. When he takes responsibility for more operations, does he also take responsibility for the anger and the frustration of the specialist who wrote to the GP last week saying, although your patient had a significant invasive tumour removed, without significant increase in resourcing, we cannot provide reconstructive plastic surgery to him or many other patients?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, once again, it's hard to comment. There's no name, no detail, no DHB. In terms of anger and frustration, the only person I know in that category is the person who's coming second to don't know, don't care in the Labor deputy leadership space.
Order. There is no ministerial responsibility there.
Minister, Mr Speaker.
Supplementary question, the Honourable Annette King.
The media thinks so, that's right.
Order. I'm might have to issue another warning very shortly. The Honourable
Thank you,
Annette
Mr.
King,
Speaker.
supplementary
When he
question.
takes responsibility for more doctors and nurses, does he also take responsibility for the looming oral health workforce crisis reported 3 weeks ago, stating a bleak outlook for kids' dental treatment over the next 5 to 10 years because of the ageing workforce, with Canterbury area alone having 77% of their workforce over 50?
The Honourable Dr Jonathan Coleman.
Well, Mr. Speaker, I know that member was a dental nurse, but I also expect her to know who's got the delegation for oral health. What I can say is there's work going on around the medical workforce right across all aspects of the portfolio. We look at this strategically, and actually, as I said before, we're doing more and more for more New Zealanders all the time, and actually oral health will be part of that.
Supplementary question, Mr. Speaker.
Supplementary question, the Honourable Annette King.
When he takes responsibility for funding Herceptin, does he also take responsibility for failing to increase Pharmac's budget sufficiently this year to allow other patients, cancer patients, to access modern biologic drugs to help prolong their lives?
The Honourable Dr Jonathan Coleman.
Well, Mr. Speaker, we've talked about this in the House before, but in actual fact, an extra 70,000 New Zealanders gained the benefits of new medicines and new designations in the last year. There were more medicines introduced, and actually, unlike that member, we are able to make better use of the money available to provide more services, more drugs, and better care for all New Zealanders.
Order, Mr. Speaker.
Point of order, the Honourable Annette King.
I seek leave to table an article from the New Zealand Medical Journal Paywall, dated the 15th of June 2007, showing that Herceptin was funded in New Zealand from July 2007, not what we've been told in this House.
Order. The document's now been more than adequately described. I'll put the leave. Leave is sought to table that particular article. Is there any objection? There is none. It can be tabled.
Supplementary question.
Supplementary question, the Honourable Annette King.
When he takes responsibility for faster cancer services, does he also take responsibility for the 1999 cancer report to the incoming government that stated cancer treatment barely met demand, there were chronic staff shortages, services were under-resourced and patients faced delay, which led to patients being sent to Australia?
The Honourable Dr Jonathan
Well, Mr.
Coleman.
Speaker, I know Annette King was around in 1999. In fact, she was around, I think it was 1981. But look, this is going back a long way. I mean, how could I on earth be held responsible for a 1999 report? This is going back 17 years. It's ancient history, just like the member herself.
Order. That part will not help the order of the House.
He's angry, Mr. Speaker.
Order.
He's angry. Point of order, Mr. Speaker.
Order.
He's angry.
Order. Now this.
He's losing.
Order. This is a point of order. Honourable Annette.
I seek leave to table the Working Party report on New Zealand Radiation Oncology Treatment Services 1999, withheld by the Minister who said he didn't have it.
Order. On the basis that this is a report quite a long time ago, I will put the leave. It may be of interest to Order. It may be of interest to members. Leave is sought to table that particular report dated 1999. Is there any objection? There is none.
Point of order, Mr. Speaker.
Point of order, the Honourable Annette King.
I seek leave to table an OIA request dated the 1st of September from the Northland District Health Board showing 93 children waiting for extractions.
Lord, leave is sought to table that particular OIA. Order. I'm putting the leave. Leave is sought to table that particular report. Is there any objection? There is none. Point of order.
Speaker.
The Honourable Dr
Speaker, I
Jonathan
seek
Coleman.
leave to table an OIA response to the Office of the Leader of the Opposition, detailing the cuts to appointments and operations under Labor from the period 1999 through to 2008.
Leave is sought to table that particular official information report. Is there any objection? There is no order. Order. When I'm putting the leave, I don't expect the conversation to carry on. So leave is sought to table that document. Is there any objection? There appears to be none. It can be tabled. Question number 2, Ian McKelvey.
Thank you, Mr. Speaker.